Toxoplasma gondii. Toxoplasma gondii. Toxoplasma gondii. Family Sarcocystis. Silent feature. Member are tissue cyst forming coccidia. Heterogeneous parasite. Sexual stage found in final host and asexual stage is found in intermediate host. Genus Toxoplasma Sarcocystis, Neospora, Benoitia, and Hemondia. Toxoplasma gondii. Toxoplasma gondii morphology. It is an obligate intracellular intestinal zoonotic coccidian parasite. Toxoplasma, toxon means arch, plasma means form. Organisms are arch-shaped. Nicole and Manchiac discovered Toxoplasma gondii from a North African rodent, Tinodactylus gondii. Hence, the organism named as Toxoplasma gondii. Toxoplasma gondii, definitive host, feline domesticate is most important in which enteroepithelial cyst occurs. Intermediate host, any mammal, sheep, goat, cattle, pig, and dog. Bird and man act as intermediate host in which extraintestinal muscles, liver, lung, brain, etc. cycle form. Unsporulated oocyst excreted through the feces of the infected final host cat. Sporogony occurs outside the host and form sporulated oocyst in environment. Three infective stages of Toxoplasma gondii: sporulated oocyst, tachyzoid, bradyzoid. Sporulated oocyst. Sporulated oocyst. Each sporulated oocyst contains 2 sporocytes and each sporocyte contains 4 sporozoids. Tachyzoid. Found in extraintestinal tissue, muscle, liver, lung, brain, etc. for intermediate host. Tachyzoids are rapidly dividing form and formed in acute stage of infection. It is crescent shaped, centrally placed nucleus with pseudocyte. Example: no definitive parasite membrane surrounding the group of tachyzoid. Bradyzoid are slow dividing form and found in chronic phase of disease. Lancet-shaped bradyzoid packed in a cyst and usually consist of thousands of bradyzoid per cyst. Size zone contains 32 merozoids and gamete stage occur in the small intestine of intermediate host. Mode of transmission. Toxoplasma gondii mode of transmission. Ingestion of sporulated oocyst along with feed and water. Ingestion of tissue and meat containing tachyzoid and bradyzoid. Congenital transmission. Transmission of T. gondii. Toxoplasma gondii development inside final host. Enteroepithelial cycle occurs. Final host gets infection by the ingestion of any of the 3 infective stages: tachyzoid, bradyzoid, and sporulated oocyst. Endogyny and endoploidy types asexual reproduction found. Development inside final host. After ingestion of tissue cyst by the final host cat, cyst wall is dissolved by proteolytic enzyme in the stomach and small intestine and release bradyzoid. Bradyzoid penetrate epithelial cell of intestine and by the endogyny and endopolygyny reproduction from size zone. Development inside final host. Size zone rupture and release merozoid which form gametes. Microgamete and macrogamete fuse to form zygote which develop into unsporulated oocyst. Unsporulated oocyst passed with the passage of infected final host. Development inside the intermediate host. Intermediate host get infection by the ingestion of sporulated oocyst. Ingestion of infected meat containing tracheozoid or bradyzoid or congenital through placenta. After infection of sporulated oocyst wall rupture in the intestinal and release sporozoid. Sporozoid penetrate the intestinal epithelial and associated lymph node and multiply to form tracheozoid. Toxoplasma gondii development inside the intermediate host. Tracheozoid through lymph and blood is spread in body organs and encysted in the brain, skeletal and cardiac muscle and liver and form bradyzoid. Bradyzoid are microscopic and survive in tissue as long as the host life. After ingestion of meat containing bradyzoid, cyst wall of bradyzoid rupture by the action of proteolytic enzyme and release bradyzoid. Bradyzoid transform into tracheozoid in the host cell. Tracheozoid multiply repeatedly and ultimately encysted in tissue. Cycle complete when tissue cysts are ingested by cat. Toxoplasma gondii congenital or transplacental transmission inside the intermediate host occurs when a previously non-infected host becomes infected during pregnancy. It occurs at any stage of gestation, but fetus is severely affected when them become infected during first half of gestation. Life cycle of Toxoplasma gondii. Toxoplasma gondii life cycle. Life cycle of Toxoplasma gondii. Different stage of Toxoplasma gondii. Cyst, cyst, gamon, oocyst. Pathogenesis and symptoms of Toxoplasma gondii. Majority of infection is asymptomatic both in definitive and intermediate host. Sapien goat, abortion, stillbirth, and mummification occurs due to encephalomyelitis and placental necrosis. Pig. Pig weakness, cough, nasal discharge, stillbirth, abortion, pneumonia, ascites, lymphadenitis, enteritis, etc. Dog. Intermittent fever, respiratory distress, diarrhea, vomition, and nervous disorder. Cattle, moist resistant. Cat, anorexia, pneumonia, icterus, fever, diarrhea, etc. Pathogenesis and symptoms of Toxoplasma gondii. Man. Infection is usually asymptomatic in immunocompetent adult but cause disease and death in immunocompromised patients and in congenitally infected children. Congenital infection occurs only when a woman is exposing to infection for the first time during pregnancy. Tracheozoid crossing the placenta and may cause abortion, stillbirth, and severely affected infants show retinochorditis, cerebral necrosis, hepatosplenomegaly, convulsion, and hydrocephalus. Diagnosis of Toxoplasma gondii in final host. Microscopic examination of feces revealed double-walled unsporulated oocyst with nucleated mass. In intermediate host, on the basis of symptoms, abortion, stillbirth, mummified fetus, etc., animal inoculation test, cerebral spinal fluid secretion, tissue fluid, etc., are of suspected animal inoculated intraperitoneally in mice. Tracheozoid will be found in the peritoneal fluid or impression smear of mesenteric lymph node, liver, spleen, etc. 7 to 40 days after infection. Diagnosis of Toxoplasma gondii in intermediate host. Sabin-Feldman ditest is used to detect specific antibody in the serum of Toxoplasma infection living suspected animal or man. Alkaline methylene blue, a complement-like serum factor, probably propradine, and antibody are used in this test. Torch panel is also used to detect congenital toxoplasmosis. Other serological tests like CFT, IFAT, ELISA, etc. Molecular tests like PCR. Treatment and control of Toxoplasma gondii. Treatment. Drugs used in treatment are sulfadiazine, pyrimethamine, and clindamycin. Control. Proper washing of hand before meal. Reduction of stray cat population. Raw offal should not be consumed by the cat. Pregnant women should not come in contact with cats. Toxovac and Ovilis Toxovac are live vaccine contain tracheozoid from an incomplete strain S48 of Toxoplasma gondii has been developed to protect ewes. Sarcocystis. 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 Family Sarcocystidae. Family Sarcocystidae. Silent feature. Member are tissue cyst forming coccidia, heterogeneous parasite. Sexual stage found in final host and asexual stage is found in intermediate host. Genus Toxoplasma, Sarcocystis Neospora, Basnoitia, and Himondia. Sarcocystis species name derived from the Greek word sarcos means flesh and cystis means cyst. It is a tissue cyst forming coccidia. Sexual stage found only in definitive host which is carnivorous, and asexual stage occurs only in the intermediate host. Sarcocystis species definitive final host usually dog, cat, and man. Intermediate host cattle, buffalo, sheep, goat, pig, horse. Location found in small intestine of final host and muscle of intermediate host. Sarcocystis species definitive host final host. Sarcocystis cruzi, cattle, dog. Hominis, cattleman. Tenella, sheepdog. Gigantea, sheepdog. Capra canis, dog. K-dog, goat dog. Herisi canis, goat dog. Fusiformis, water buffalo dog. S. Mischeriana, pig dog. Cystic sarcosis species definitive host final host. Sui hominis, pig man. Porcephalis, pig cat. Neurona, horse opossum. Gigantea, sheep dog. Capra canis, dog. Goat dog. Fusiformis, water buffalo dog. Mischeriana, pig dog. Sarcocystis species is sporulated oocyst contain 2 sporocysts and each sporocyst contain 4 sporozoids. Sporulation occurs inside the host. Different stage of development. Sarcocystis. Terminal asexual stage found ancested primarily in the striated muscles of intermediate host. Metrocystis. Mother cell. Immature sarcocystis contain globular parasite called metrocystis. Bradyzoids. Metrocytes from banana-shaped bradyzoids by endodyogeny type of asexual reproduction. Life cycle of Sarcocystis species. Infective stage of Sarcocystis species. Infective stage of definitive host. Cyst containing bradyzoid. Infective stage of intermediate host. Sporulated oocyst. Transmission of Sarcocystis species. Transmission of infection. Final host get infection by the ingestion of Sarcocystis or bradyzoid containing meat. Intermediate host get infection by the ingestion of sporulated oocyst containing feed and water. Life cycle of sarcocystic species. Final host get infection by the ingestion of sarcocyst or bradyzoid containing meat or of infected intermediate host. Bradyzoid are liberated from the sarcocystis after digestion by the GI juices. Bradyzoids enter lamina propria of villi and small intestine and from micro and macrogamete bones. Life cycle of Sarcocystis species. Fusion of micro and macrogamete result formation of oocyst which sporulated in the intestine and free sporocysts are passed with feces of the infected host. Intermediate host get infection by the ingestion of sporulated oocyst containing feed and water. After excitation, sporozoids are released and enter capillaries of the different organs. Sporozoid after zygogony process from merozoid which transform into sarcocystis in the muscle cell of tongue, heart, diaphragm, etc. Pathogenesis and symptoms. Sarcocystic cruzi is the most pathogenic species in cattle. Symptoms include anorexia, fever, marked loss of hair at the end of the tail, often in cattle, submandibular edema, exophthalmia, hemorrhages on the serous surface of viscera, neurological sign, lymphadenopathy, enlargement of lymph node, cyst in myocardium, esophagus, tongue, and masseter muscles, and abortion in breeding stock. It-caused disease in cattle is known as Delman disease in Canada, USA, and UK. Pathogenesis and symptoms. Sarcocystis species pathogenesis and symptoms. Sarcocystis tenella is most pathogenic species of sheep which cause abortion, myositis, encephalomyelitis, and dog sitting posture in lamb. Sarcocystis neurona causes a serious neurological disease of horses called equine protozoal myeloencephalitis (EPM), which lead ataxia, muscular weakness, etc. Diagnosis of Sarcocystis species. In final host, microscopic examination of feces revealed sporocyst containing 4 sporozoids. Diagnosis of Sarcocystis species in intermediate host on the basis of clinical signs like anorexia, fever, abortion, dog sitting posture in lamb, etc. PM examination by digesting striated muscle in pepsin HCl revealed sarcocystis on microscopic examination or naked eye. Other serological tests like CFT, IFAT, ELISA, etc. Molecular tests like PCR. Treatment. Sarcocystic species treatment. Use of prophylactic anticoccidials may prevent or minimize sarcocystic infection in the intermediate host. Amprolium in calf, salinomycin in sheep, and halofuginone in goat reduce or prevent acute sarcocystosis. Sarcocystosis species control. Raw or undercooked meat or offal should not be fed to dogs. Man should consume properly cooked meat. Dog and cat should not be entered inside animal premises. EPM vaccine contain in vitro cultured merozoid chemically inactivated used against S. neurona in horses. Neurospora caninum. Neurospora caninum. Neospora caninum. Neospora caninum. Neospora caninum is a newly recognized fetal epicomplexan protozoal infection of dog and other animals. It is a heterogeneous parasite. Neospora caninum definitive final host dog, intermediate host, dominant host, and dog. Each sporulated oocyst contains 2 sporocysts and each sporocyst contains For sporozoid, sporulation occurs outside the host. Neospora caninum, non-sporulated oocyst, sporulated oocyst. Life cycle of Neospora caninum. Trachezoids are found in neural cell, fibroblast, macrophage, and other cell of body, whereas bradyzoid tissue cysts are found only in neural tissue, brain, spinal cord, retina. Bradyzoid are the infective stage of definitive host dog tissue cyst. Bradyzoid infected dogs shed unsporulated oocyst which become sporulated in environment. Life cycle of Neospora caninum. Each sporulated oocyst of Neospora caninum contains 2 sporocysts and each sporocyst with 4 sporozoids. Intermediate host may get infection by ingestion of food and water contaminated with Neospora caninum sporulated oocyst. Life cycle of Neospora caninum. Trachezoid of Neospora caninum has been transmitted from infected mother to fetus in cattle, sheep and goat. Neonatal calf may also get infection through the ingestion of trachezoid containing milk and colostrum. Life cycle of Neospora caninum. Transplacental transmission is the only proven route of transmission in dogs. Unlike toxoplasmosis, exposure of animal prior to pregnancy fails to prevent transplacental infection during subsequent pregnancies. Life cycle of Neospora caninum. Symptoms of Neospora caninum. Clinical symptoms include ascending paralysis of hand limb, difficulty in swallowing and paralysis of jaw, rhinitis, encephalomyelitis, myositis, etc. Transplacentally infected pup develop severe neuromuscular disease. Treatment of Neospora caninum. Treatment. Drug used in the treatment of neurosporosis are clindamycin, trimethoprim plus sulfadiazine, pyrimethamine, etc. Vaccination. Bovilis and NeoGuard are the commercially available vaccine containing killed trachezoid which reduce abortion in pregnant hosts. Types of oocyst. Types of oocyst. Genus Eimeri species. Tetrasporocyst, bisporozoid, 4 sporocysts, and each sporocyst contains 2 sporozoids outside the host. Isospora, Toxoplasma, Sarcocystis and Neospora species. Bisporocytic, tetrasporozoid, sporocytics and each sporocyst contain 4 sporozoids outside the host except Sarcocystis species. Cryptosporidium species. A sporocystic tetrasporozoic 4-necked sporozoid inside the host. Cryptosporidium. 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 Genus Cryptosporidium. It is an intracellular extracytoplasmic organism located in the notch of microvillus membrane of the digestive epithelium of gut wall and enclosing the parasite within a parasitophorous envelope apparently derived from microvilli. Genus Cryptosporidium. It also found in respiratory epithelium. It is an emerging coccidian parasite found in animal, bird and man. Monogenous parasite with direct life cycle. It has smallest oocyst among all coccidian. Oocysts are spherical to ovoid in shape and oocyst wall is bilayered, smooth and colorless. Sporogony occurs inside the host. Sporulated oocyst excreted through the feces of the infected host. Each sporulated oocyst contains 4 naked sporozoids without sporocyst. Cryptosporidium species host. Cryptosporidium parvum ruminant, hominis man and monkey, bovis cattle, cicanis dog, Sessuis pig, ballet bird. Genus Cryptosporidium life cycle direct. Infective stage thick wall sporulated oocyst. Transmission host get infection through injection of sporulated oocyst, through contaminated feed and water or through inhalation aerosol. Genus Cryptosporidium transmission autoinfection occurs in Cryptosporidium because thin wall oocysts do not leave the host is intestine and initiate a new developmental cycle. Unlike the members of the Illimeridae, it does not enter the cell of the host and lack host specificity, so that cross infection occur between domestic and laboratory animal and bird. Two types of oocysts are formed. Example: thin wall and thick wall oocyst. Thick wall oocysts pass out in the feces of the infected host, whereas the thin wall oocysts exist in the gut and release sporozoid cause autoinfection. Life cycle of Cryptosporidium. Pathogenesis of Cryptosporidium. Pathogenesis of Cryptosporidium. Generally, young hosts like calves, kids, lamb, children, etc. are most affected. It causes villus atrophy, degeneration, slugging of enterocytes, crypt, hypertrophy, inflammation of epithelial cell, etc. Symptoms depend upon species of parasite and the age and immunity status of the host. Watery cholera like diarrhea is the cardinal sign. Symptom of Cryptosporidium. Symptoms. Other symptoms are weight loss, abdominal discomfort, dehydration, etc. Cryptosporidia is also regarded as potential causes of traveler's diarrhea. Diagnosis. On the basis of symptoms like watery cholera like diarrhea in young host, diagnosis is made by observing very small sporulated oocysts in gel-Nielsen strain, acid fast strain or kidney acid fast strain fecal smear. Treatment drug like azithromycin, paromycin, etc. are used in treatment. Control. Proper disposal of fecal or stewed uncooked vegetable like salad should be taken after proper washing of hands before meal. Thank you.